Good morning, everybody, and thank you very much indeed for inviting Scotland to give this presentation on housing. And a very big thank you to the organisers from the Forces in Mind Trust Research Centre for organising this conference. I know from previous conferences that it's going to be a fantastic day, and I think we're all looking forward to the opportunity to network face-to-face for the first time in over 2 years. I'd like to start by introducing our team. We're all veterans. If my maths is correct, we've got something like 141 years of service between us, which sounds rather frightening. But first of all, immediately to my right is Charlie Wallace, who is Scottish Veterans Commissioner, and he took up that post in September 2018 after completing 35 years service in the Army. He's followed a traditional career in the infantry, holding various command appointments on operations and at home. He's in the closing days of his appointment as Scottish Veterans Commissioner, and I know we're going to miss him very much, and we wish him very well in his future career. Next to Charlie is Kevin Gray, who completed 26 years service in the Scots Guards in 2011, having served all over the world. He was decorated with the Military Medal in 1991 for services in Northern Ireland. After retiring from the Army, Kevin joined Royal British Legion Scotland, and in February 2012, he was appointed its Chief Executive Officer. In 2018, he joined Veterans Housing Scotland as their Chief Executive. And most importantly for us today, he chairs the Veterans Scotland Housing Group, which recently developed and published the Veterans Homelessness Prevention Pathway. And the fourth member of our team is Martin Nadin, who enlisted in the Army in 1977. Initially, he trained and practiced as a biomedical scientist in the RAMC, and he was then commissioned and spent the remainder of his service planning and executing worldwide medical support and developing military medical capabilities. He left the Army in 2016 and worked in the NHS in England for 2 years, leading a project team that merged 2 NHS foundation trusts in the West Midlands. In 2018, he was appointed Chief Executive of Scottish Veterans Residences, Scotland's oldest military charity. And me. I served in the Army from 1970 to 2012, first of all as an Army GP in diverse places such as Germany, Northern Ireland, some nice postings such as Hong Kong and Belize, and then as a consultant public health physician, mainly at the Army Medical Directorate, although the last 3 years of my service I was Military Medical Liaison Officer to the Scottish Government. When I retired from the Army, I went to the University of Glasgow to do some research on long-term health of veterans, utilising Scotland's excellent linked electronic health records. And I now run the Scottish Veterans Health Research Group there. And I'm also Honorary Civilian Consultant Advisor to the Army in Veterans Health and Epidemiology. Now, you might wonder what a doctor is doing introducing and chairing the session on housing. It's not a logical progression. Well, leaving aside my family background, my father was a chartered surveyor working in local government, and in the 1960s and 1970s he oversaw a very large number of projects to improve the UK's very poor housing in a lot of the inner cities. So I very much grew up with a background of the importance of housing to people. But if we look at this diagram, which has featured in a number of public health reports, which shows us the determinants of health, you'll see that actually housing is a very important one. And if we look at this picture from the 1960s, that's not very long ago. A lot of us in this room will remember the 1960s. And you look at this poor girl pushing a baby in a pram, and that baby, if it survived, is now going to be probably 60-ish. It's not a great start in life. So from that point, with a lot of housing stock being very badly deteriorated after the Second World War, and a lot of these houses have been put up in the aftermath of the Industrial Revolution, the only way was up. But there are still major issues. And if we look at this diagram, for anybody who's ever done a management course, you'll be familiar with Maslow's hierarchy of needs. And essentially what it does is it summarizes what is really important in life. And if you look on the bottom row, that's the things that are absolutely critical. Safe water, freedom from air pollution, safe food. But on the second layer up is housing. And if we don't get it right, the closer to the bottom of that pyramid you are, when you pull out a brick, the more likely it is that it's all going to come tumbling down. So housing is absolutely key to people's health. And the first thing that goes is mental health. But we now have increasing evidence from not only our own research, but research in many other fields worldwide, that mental health and physical health are inextricably linked. And people with poor mental health are much more likely to have poor cardiovascular health, so they're more at risk from heart attacks, atherosclerosis, and many other things. But also there's a linkage with various cancers. And our own paper published recently showed that people who have PTSD are more likely to have type 2 diabetes. So there are all sorts of issues as far as health that you can trace directly back to housing. But there is good news, and the majority of veterans, it must be said, don't have a problem with housing. And a lot of veterans own their own homes, and actually overall veterans are no less likely than non-veterans to be homeless. But not everybody does well, and that's why we're here today. And the people who don't do well might well be young leavers who've got no experience of finding their own accommodation, might be people who've been medically discharged and didn't expect to leave, people who fall on hard times for all sorts of reasons. And then we start thinking about rough sleeping. Now, when you use the word homelessness, I think a lot of us in the room who are professionals understand the difference between homelessness and rough sleeping. But generally the public don't. And if you say homeless veterans, people immediately have that sort of mental perception of people on the street sleeping in a sleeping bag on a couple of bits of cardboard. That is not the same thing. And recent data from London shows that only 2% of rough sleepers were actually veterans. You do hear it said that the majority of people who are rough sleepers are veterans. Now, that's an old piece of data, and it doesn't take account of the reality that in the 1960s and 1970s, in the aftermath of World War II and national service, the vast majority of adult men in this country were veterans. So it's unsurprising that, given that the majority of rough sleepers are adult men, it was unsurprising that at that time, veterans were highly represented amongst the rough sleepers because veterans were highly represented throughout society. Now, that has changed, and recent data shows a very, very different picture, as you'll be seeing. As far as the legal position's concerned, if somebody is homeless, and we can summarize what homelessness means in terms of not having a front door to call your own. So if you're having to sofa surf, or if you're having to sleep on in a friend's house, effectively being looked after by somebody else, you count as homeless. The local authority does have a responsibility to house people who are involuntarily homeless. If people are offered accommodation, then they have a responsibility to take it, even if they don't like it very much. And I've heard of veterans who've said, oh, well, yes, they offered me accommodation, but there were too many old people in the area, I didn't like it. Well, that's just tough. If you're homeless, any port in a storm is going to have to do until you can improve your lot. And you'll hear in the presentations to come how that's going to be addressed. In terms of numbers, as you can see, not great and reducing. Kevin is going to be telling you an awful lot more about the numbers, so I won't dwell on that because time is pressing on. And there are a variety of reasons for homelessness, looking at national statistics from Scotland. There's no one that dominates, But if we look at the age of the homeless population in Scotland, that tends to be younger than the Scottish population as a whole. Now, you will hear that there are some differences with the veteran population, and I think that's going to be quite important as we develop this theme over the course of this presentation. And then the support needs that people have. Again, this is civilian data, and it shows that the majority of issues are to do with mental health and to do with people who just haven't learnt basic housing skills. But it's quite age dependent. The lack of housing skills, understandably, is skewed towards the lower end. People with medical conditions, people with physical disabilities, tends to be skewed towards the older end. And again, we'll see how that applies to veterans and how it differs in the veteran population from the civilian population. So, in summary, it's unsurprising that many of the reasons for veteran homelessness reflect the sort of reasons that occur in the wider community, but there are some important differences as well, and that's what we're going to be looking at over the next few minutes. Now, those differences are really what makes veterans special, and it's because of those differences that we need to address the issue of homelessness in veterans differently from the issue of homelessness in the wider community. It's why we're here today, and it's why we can justify having special provision made for our veterans. With that, I'm going to hand over to Charlie Wallace, who's going to give us an overview of the Veterans Commissioner and the strategic picture. Charlie.
Thank you very much indeed for that. I think I ought to start by saying that I'm not an academic and I'm not a researcher. I am just an old soldier, which I think gives me one advantage in being able to look at the population in which we live and take a wider view about what our relationship is, the veterans community is, with our society. But before I do that, I just want to perhaps tell you what the Veterans Commissioner is. My role was created in 2014, and I'm the second Veterans Commissioner. It was created by the Scottish Government, not the UK Government, and so it is to the Scottish Government that I work, which creates quite an interesting challenge for me in policy terms when I have to work with some of those areas that are the responsibility of the UK Government, who I have no jurisdiction at all, and the Scottish Government, who maybe, because of the political circumstances we have in Scotland, would like to make sure they're trying to get one over the UK Government. So there is always a very pleasant tension there, and indeed Jesse and I were talking about this last night. And it's the way that I try to sum it up is I think that the Scottish Government is responsible for receiving veterans into its community, where it has, in the devolved space, the responsibility for housing, health, education, careers development, and skills development. And I think it's the responsibility of the UK Government to prepare those service leavers who are going to go and move to Scotland. And each year we have something in the order of about 1,400 to 1,800 service leavers who are coming back into our community in Scotland. So unless the UK Government is doing its bit in preparing for those individuals who may be serving in Plymouth or Catterick or somewhere else in the UK or indeed around the world about what life is like in the devolved space in Scotland, then those veterans may arrive not understanding what it is that they're coming into, and then they get confused about the facilities that are there to support them. I've been asked to talk a little bit about the strategic context, and in that I want to just highlight that we now have two other Veterans Commissioners, one in Northern Ireland and as of about 4 or 5 weeks ago, one in Wales, who I think is about to start work in 2 or 3 weeks' time when he leaves the military. Those two work to the UK Government. They are sponsored by the Northern Ireland office and the Welsh office, respectively. So they don't work directly, nor are they actually contracted to engage with the local assemblies in Northern Ireland and Wales. So they're going to have a different set of challenges to the ones that I have. But it's just as important, I would argue, that in that devolved space in Ireland, in Northern Ireland and in Wales, we've got to address those issues that are responsibilities of those local assemblies. But in that strategic space, I see a series of challenges. And they are ones that have constantly reappeared in every bit of engagement that I've done over the last 3.5 years. The first one is that devolved space. And Jessie talked about it. I think it was her 4th priority out of the 5, about the business of working with the devolved administrations and trying to pull things together so that their service lever has a seamless transition into the region of the UK that they're going to move. The second one is about relating and connecting to the wider society. When I left the military in 2018, I was dumbstruck by just how ignorant, I think is the word I would use, proportions of our society are about the military and its purpose and what it does. Now, that is not an ignorance by choice. It's just, I think, an ignorance of success or a recognition of success of our society. That we have got generations now of people who will have no connection at all with the military. They will not understand what the military is about because their lives, at their particular level, doesn't require them to worry about it. Now, that may have all changed 4 weeks ago, and maybe, just maybe, there is an opportunity here. But as a result of that, their views of the military tends to be made by what they see in the media. That in itself tends to be sensationalist, as we all know. And therefore, their impression of what a veteran is, and more importantly, what a veteran can do to contribute to them, is probably a little bit skewed. And that creates a division which in itself becomes challenging for that veteran who's trying to come back into their society. The other challenge, of course, is the veteran themselves, who may be lacking in confidence as they come back into that community. And if that community is not open and friendly to them, it may exacerbate their own concern and their own lack of confidence. So what do? They will then probably turn in amongst themselves to try and gain that confidence, which in itself, one could argue, is then stretching them away from that society and not embracing them in it. Now these are real challenges that we've got to address. And the community that we've got here, all of us, we're all in this room because we have a view about veterans. We want to get engaged. There is opportunity to do something good, and that is very, very obvious. I think we have all got a role to do to get out there and talk to people who don't know about the military. And that is quite a challenge, I suspect. I think there's also a challenge about us being proud of our country. Now, that also depends on where you sit in our country. Are we talking about the United Kingdom, or in my case, are we talking about Scotland, Northern Ireland, Wales, or England? And if we're not proud of our country, then is it not more challenging for us to be proud of the people who stand up and want to protect our country? So how do we address that? And this is a question for our politicians in making us proud of who we are. And in fact, isn't it interesting when we look at Ukraine now, and how proud they are of their country and what they're doing and how people want to support them. So when is it our turn in the United Kingdom? And of course, for me, I've got the additional challenge of having an extra government to deal with who would have a view that is distinctly separatist from the United Kingdom. And they are very proud of Scotland. And there are very many veterans who are proud of Scotland. But are they proud of the United Kingdom? And if they are not, then it's going to be more challenging for them as they get back into their communities. And my final challenge, I think, is about understanding relationships. Amongst us all in here, we're all gathered together, we're talking and we're interacting and we're gaining something. I would argue that every single conversation that you have today, there is some sort of transactional nature to it. You are gaining something from having a conversation with others. And I think that's perhaps one of the answers that we have when we have to speak to those outside our community who are genuine civilians and who do not know anything about the military. I think there is a chance for us to transactionally engage with them by telling them the talent that the veterans community has got and how they can add value to their workplace. And that's probably going to open their minds into a more basic binary way of understanding that veterans are not a frightening, odd sideline community, but actually bring a lot of very good soft skills to the workplace. So that as a backdrop, what I think is going to happen now is we're going to delve into the detail about how we look at housing specifically in Scotland. And the experts here, with Kevin and Martin, will I think, try to address some of those points that I've tried to raise. But it is a challenge for us all. But what is really reassuring from my perspective is that just so many of us are willing to step up and do something for a community that has done something for our country. Thank you.
Thank you very much indeed, Charlie, for that excellent overview. I now call on Kevin Gray, who's going to tell us what Scotland has been doing to prevent homelessness in Scotland.
Thank you, Beverly. Thank you, Charlie. Good morning, everybody. As you know, my name's Kevin Gray. I'm the Chief Executive for Veterans Housing Scotland. I'm absolutely delighted to be here today to give you a very brief introduction, i.e. a plug, about Veterans Housing Scotland, talking about housing support and the current provision that's actually happening in Scotland. Then delve into a little bit more detail about the Veterans Homelessness Prevention Pathway, which we've been working on for the last 14 months, looking at what we know, why and how the pathway was developed, who we spoke to, where we concentrated our efforts, and ultimately give you a very brief flavour of the pathway themes and recommendations that we came across. Clearly, there's not enough time today to go through all 7 themes and all 24 recommendations that we came across. So first of all, the plug on, maybe not the plug, the plug on Veterans Housing Scotland. We were formed in 1915. The original name of the Scottish Veterans Garden City Association, or the Scottish Garden City Housing Society, whichever one you chose to use at that particular time. And ultimately, the aim was to ensure that veterans returning from the war had access to affordable and appropriate homes, were able to lead independent, healthy and active lives in secure and positive environments. You might be surprised to know that that's still the current aim today. How we deliver that might have changed, right? But it's still very much the same aim as it was about 107 years ago. However, you can also see when we start talking about Scottish Veterans Garden City Association, how it was important in 2021 that we adopted the name of Veterans Housing Scotland, that we think better reflects what we do as an organisation. We are the largest military charity in Scotland providing homes for disabled veterans, and the current portfolio that we've got is about 660 properties throughout the whole of Scotland, and you'll see the spread of that in a few minutes. That being said, we're not alone in that provision. This is quite a busy slide. It shows just the top line providers of both housing and support for veterans in Scotland. And clearly the organisations on the left-hand side of the screen there, they provide a limited, although very, very important, number of both homes, about 952 homes, and 469 supported accommodation stroke care home beds. So pivotal on how we support veterans on that side of things. On the right-hand side is the support organisations, the service charities, and clearly there is more than what we could fit on that slide. But it just shows you an area where we all work together to provide support for veterans in need. The centre one is the 32 local authorities in Scotland. They play a crucial part in the delivery of providing homes for those in need. Beverly mentioned earlier on about some approach of there's your house, take it or leave it. That is sadly the case in some cases. That's what we are led to believe. And when we start talking about tenancy sustainment in a few minutes' time, that will highlight why that approach doesn't always work. Because clearly if somebody's in need of a house, 9 times out of 10 they will take that house based on the fact that it's there. It might not be appropriate for their needs, and that's what we've got to focus on going forward, because otherwise we just lead into further problems down the road with tenancy sustainment. The bottom group is the veterans themselves. Clearly, they have got to play a part in what they do, in their own support, in their own housing, how they look after their house, and how they look after their own tenancy sustainment. They've got to play a part in that. What we've got to do is manage their expectations. Now, on some occasions, now you'll probably hear later on from Martin, on some occasions we have veterans or people who are going through the transition process who have, and it's not all, right, but who have some sort of sense of entitlement. Now, they see veterans charities providing homes, they automatically think that they're entitled to one of those homes. Right? So we've got to manage their expectations. But what is key, and again I think it's shown on this slide here, is that, and it's been mentioned already by Jesse and Sam, is collaboration, cooperation and communication are absolutely key to getting the best outcomes for those who need our support. And that's what we should do going forward. Some numbers now. Again, mentioned by Jesse, we're all really, really looking forward to the results of the census so that we can actually get some strong data to base our decisions on going forward. Scotland, as you know, will be slightly behind the curve on that, right? Because I think they only just finished the census on the 20th, a few days ago. Okay, so they'll be some way behind the rest of the UK in getting the results of that. But clearly, we're very, very keen to get those results as soon as possible. But what we do at the moment is we base it on the figures that are on the screen here. And they represent the changes in the veterans population in the UK between 2016 and 2028. And you can see, and it's already been mentioned, that there'll be a considerable reduction from around 2.5 million in 2016 to around 1.6 million in 2028, with the current estimate being about 2 million for this particular year. But as well as a reduction in size, the age gender profile of the ex-force community is also set to change. The percentage of veterans of working age, i.e. between 60 and 64, is set to increase from 37 to 44%. And likewise, the number of female veterans is also set to increase from 10 to 13%. Just to bring that into some sort of perspective from a Scotland basis, we use the very, very rough figure of the Scotland's veterans community represents about 9% of the UK total. So on current numbers, we're looking at about 200,000 veterans in Scotland, reducing to about 160,000 in 2028. What's also important is not just the numbers, but the location of veterans. There's two images on the slide here. The far left one, as you can see, is the breakdown of the concentration of veterans. The darker the brown colour is the more concentrated the veterans are throughout the whole of Scotland. You can see that that's relative to where the military bases are. You can just about see RAF Lookers, Royal Marine Condor, etc. Not so much in the central belt, because I think the brown just sort of merges in with it. But you can see that it's relative to where the military bases are. On the right-hand side, you can see where the military charity provision is actually there, and you can see that roughly mirror images the screen or the slide on the left-hand side. The areas in blue are the areas that are covered by Veterans Housing Scotland, with their 653 properties throughout the whole of Scotland, and the other ones, Scottish Veterans Residencies, etc., are all indicated their locations by the red arrows. And again, there's no pun there for the Royal Air Force. What a few people may not understand, and you can be forgiven for not understanding, is Scotland is fairly small in regards to area size. However, there's vast areas of nothing. So people sit there and say, well, just nip up to Inverness. Just nip up to Fort William. No, it's not quite as easy as that. It's actually quite difficult. Okay, so you can see why the concentration of veterans is quite important. What came through the consultation we had with Defence Transition Services and the Veterans Welfare Service, and it's not shown on these slides, is that there seems to be an emerging and an increasing demand for single-person properties in the north of Scotland, up in the Highlands. Again, so the picture may be changing, and again, I think this goes back to why the results of the census are really, really quite important for a whole host of reasons. So So talking now more about the Veterans Homelessness Prevention Pathway. Now, the Veterans Scotland Housing Group's been working on that, or had been working on that for about 14 months, and it was released in January this year. It was launched in January this year. It covered a number of areas. It covered general veterans homelessness. It looked at policy and practice, and it also looked at how we ensure equality going forward. We came up with 7 themes, 24 recommendations. You'll be pleased to know that I'm not going to start listing every single one of them, because then I'll start eating into Martin's time, and he won't be very happy with that. However, you can download the full report from the Homeless Network Scotland website. Again, some numbers. There's been a significant improvement in services over the last decade, with veterans homelessness reducing from around 1,350 in 2011 down to 670 last year, in 2021. So something is positive is happening out there that is reducing those numbers. That being said, clearly 670 is still far too many to deal with. Although they are being dealt with, no, it's still far too many. The vast majority of cases are dealt with by local authorities, social landlords and housing associations, providing 73% of the houses for those individuals. But again, going back to what I said earlier on about somebody just taking a house because it's there, it might not be the most appropriate house, and how we deal with that going forward. Worryingly, and again, these are Scottish Government statistics, worryingly, that even though contact was maintained with the veteran, we don't know what the outcome was for 6% of those. How? I've got no idea. Right? But I think that's something that we need to address going forward. Again, mentioned by Beverly earlier on, the traditional belief is that early service leavers are most at risk. And while they do have challenges and tend to have poorer employment, health and housing outcomes, there is another group that's starting to emerge as being at risk. And that's the more established veterans. That's those who have served more than 5 years. They've hit a bump in the road. The relationship breaks down. Tenancy sustainment starts becoming an issue for them. Right? It's a group that up until very, very recently, the focus hasn't been on them, and there needs to be some focus put on them in regards to sorting out their needs. Not surprisingly, single males make up the majority of those veterans who made applications. You wouldn't believe I served, I'm just going off at a slight tangent here, you wouldn't believe I served 26 years in Scots Guards and had a very successful career. And I keep on looking behind me at that screen there, and I've just noticed there's one sat there. Yeah, observation skills lacking. Oh, God, here we go. It's all going to go downhill from here, isn't it? So again, a very important thing, and again, I think this is tied into the point I just made about the more established veterans now becoming a group that are at risk. Now, the age profile of veteran applicants, now you can see from this slide, is that the vast majority of applicants or homelessness applications come from people who are in the age bracket of 35 plus. And again, I think that's just another indicator that something is going wrong with the more established veterans. 30% of them actually require mental health support as well. Again, so it's an emerging issue. Interestingly, the Scottish Government stats actually state that if you are a veteran, you're more than likely to have been involved in rough sleeping, either the previous night before you applied or in the previous 3 months. Now, and quite a significant difference between veterans and non-veterans on how that's affected them. So, veterans homelessness. What do we know? The veterans are not disproportionately likely to experience homelessness. Around 2.5% of homelessness applications last year were from veterans. The numbers are falling. However, veteran applicants are more likely to be male and older than non-veterans. They're more likely to have complex needs, especially in the areas of physical disability, general medical conditions, and mental health issues. They're more likely to have multiple issues, more than one issue. And they're more likely to have slept rough, i.e. the night before or in the previous 3 months. However, they're less likely to have learning disabilities, and less likely, and again, this is something that people may not be aware of because of the perception, is that they're less likely to have issues with drug and alcohol dependency than non-veterans. So how the report was developed. While homelessness among veterans has reduced in recent years, we know that some still find it challenging to access and sustain appropriate housing. So as part of the Ending Homelessness Together action plan, the Scottish Government approached the Veterans Scotland Housing Group to take forward the work to develop a veterans homelessness prevention pathway for service leavers and veterans. For those of you that are not aware of who Veterans Scotland is, I think the way that I would liken it is it's a smaller version of COBSEO. Okay, they look after about 80 armed forces charities in Scotland as the umbrella body for them, and the housing group sits within their pillar structure of support. In the report, we set out the evidence around the housing challenges encountered by some veterans and identify where changes are needed in policy and practice to help address these challenges. We drew on 3 primary sources of evidence. We spoke to veterans with lived experience, clearly very important to hear how they've seen the impact from transition and, obviously, the more established veterans. We engaged with housing providers and support organisations through meetings, including a major consultation event with Homeless Network Scotland, where with 60 different organisations, and this was the last consultation we'd done, and it was used as a sanity check to make sure that we were on the right road before we launched the report. And we reviewed existing research about veterans' homelessness and housing issues, and it was through this combination of evidence that gives a clear picture of the things that are already working well to support veterans facing housing difficulties and the areas that still need to be addressed. So we looked at 3 areas: veterans homelessness in general, policy and practice, and then equalities. We looked at the definition and level of homelessness among veterans, the factors contributing to homelessness, specific veterans groups, and the barriers to accessing housing support. We explored the Armed Forces Covenant and the strategy for our veterans. We looked at MOD support for transition, homelessness and housing policy, and what services address veterans' homelessness. And it's clear that in the past decade, since the Armed Forces Covenant was introduced, that vast progress has been made in that area. And then we looked at how we ensure equality by looking at veterans' gender, age, ethnicity, sexuality, gender identity and faith. And this is where we had a slight bump in the road here with this one, because we found that the evidence out there to try and formulate a number of recommendations to look into this was lacking. So one of the main recommendations that we've made is that we've got to commission research into veterans groups that are most at risk. So the pathway and some of the recommendations. As we said, we had 7 themes, 24 recommendations covering the 3 areas of activity that I just mentioned. And the first one was appropriate and timely information. Both veterans and non-veterans, support providers and military support providers all claimed that the information that they had access to was there, but it was difficult, it was confusing. No, it was hard to pick out the bit of information that they needed to help them sort out their individual problem. So it's not a case of the information isn't there, it was just hard to find. Use of jargon. No, veterans talking to non-veterans, non-veterans talking to veterans. No, we found that people talking to each other didn't actually understand each other. So the use of jargon was important, and we need to address some of that. So we've recommended that there should be a complete review of all information to ensure it's consistent and ease of access. Complexity of the housing system. Wow, for people that have not been involved in housing, it can be confusing for anybody. But for those who have spent a life in armed forces accommodation, who then come out over a period of time, trying to access and navigate the system was actually confusing for all. What didn't help was the different systems that are used throughout the 32 local authorities and the different policies that were in place. That just compounded the challenge for the users. So we've recommended that there should be a named point of contact, i.e. a navigator role that helps veterans navigate the system. We've also said the Scottish Government should ensure there's sustainable funding for other services that are currently in place helping veterans, i.e. Housing Option Scotland. Right? But clearly the funding has got to be in place for that. And crucially, going back to the collaboration, cooperation and communication side of things, we've recommended that there should be a Veterans Scotland Housing Alliance, a more formal approach, maybe working to a charter, that all work together, right, but as an alliance to address these needs. Coordination and awareness of veterans' issues. Again, I think we do it well in Scotland, but there's always still room for improvement. We are a small, close-knit organisation. It's not unusual for us all to go to the meeting and we're all sitting there and we all know each other. And again, that helps us address needs because we've built that relationship. But there's still more work that needs to be done on that. Delayed transition. This is where we start talking about the more established veteran hitting that bump in the road with a relationship breakdown. How then do they navigate the housing system? And again, tenancy sustainment is coming through quite a lot, especially over the last few years through the COVID period, as being a main issue. So it's something that we need to address, especially in the private rented sector. We find in the social sector there is support mechanisms in place, but not so much in the private rented sector, and that needs to be addressed. Specific policy barriers, 56-day rule for applications, still the need for the local connections for housing. Again, that's being looked at and there's consultations happening as we speak to remove that. But again, the recommendations that we have is that we must remove the local connection for housing. Social landlords and housing associations should make a priority or prioritise veterans. And we should look at how we consistently manage local authority policies throughout the 32 local authorities. Equalities, as I've said, the evidence is very thin, and we've recommended that we should commission research into the veterans groups most at risk. And the last one, and again this is crucial, is the implementation of the recommendations. We were very, very clear that we didn't want to provide a report that took 14 months to produce for it just to lie and gather dust on a shelf. No, it had to be credible and it had to be able to be actually implemented. So we've recommended that there's an implementation group formed and that will be overseen by the Homelessness Prevention Strategy Group. Ladies and gentlemen, clearly that was a very quick tour of the pathway themes and the recommendations. As I said, the main thing can be downloaded from the Homeless Network Scotland, and then that will allow you to see the full report. But thank you very much for your time. It's been a pleasure talking to you, and I'm seeing some questions coming in, so no doubt I'll be talking to you again very, very shortly. But thank you very much for your time.
Thank you very much indeed, Kevin. And I'd now like to welcome Martin to the podium to tell us about the safety net for veterans.
Thanks, Beverly. Can everybody hear me? Okay. So let me recap on my colleagues' presentations and set up my stall and my role within the overall context of housing in Scotland. So you've heard Professor Beverly describe the national legal and policy perspectives and the significant role that housing plays in the health and well-being of the population, not just veterans. And she's given you some statistical analysis and commentary from that level. And as he approaches the end of his appointment as the Scottish Veterans Commissioner, Charlie provided his reflections of veterans' issues in Scotland during his time in office. Kevin showed you the discrete veterans' housing provision that is available in Scotland and described the work undertaken over the last 14 months or so to develop that prevention pathway, and gave you some examples of the report's themes and recommendations. And now I'm going to ratchet the microscope down a bit and give you my perspective as a veterans housing provider and a provider of supported housing for some of the most challenged and indeed challenging veterans who are homeless. I'll tell you why we do what we do. I'll show you our resources and how we provide support, and I'll finish with an overview of the figures we've just assembled from 2021, which shows where our veterans have come from, where they go to, and what they get up to when they're with us. But first, I'd like to start with a vignette. So this is Bill. Bill came to Scottish Veterans Residences in January 2020, during a very difficult time in his life. He spent 12 years in the Royal Logistic Corps, completing tours of Afghanistan and Iraq, and then he left the army. And sometime afterwards, his marriage began to fail and break down, which eventually led to divorce. And Bill found himself homeless as his wife retained possession of their home. For a while, Bill lived in his car until he was found sleeping in it by a couple of police officers in Edinburgh. They brought him to our Whiteford House residence, from where we provided him with accommodation and the support he needed to address his situation and make plans for his future. During his time at Whiteford House, Bill took part in its lockdown challenges. These were physical challenges that the residents decided they would do during lockdown because there wasn't a lot else to do, frankly. He also did some canoeing. He renovated our garden furniture, and he set himself up in a little business to build bird tables and bird feeders. For him, Whiteford House was a safe place when he needed it most. And it provided him with the support and time he needed to come to terms with his situation and be able to move on, which in January of 2021, he was able to do so. And he moved into his own flat, let by a social housing provider. And Bill now is working as an HGV driver and studying countryside management at Scotland's Rural College. So why do we do what we do? I expect that some of you are familiar with Simon Sinek's Golden Circle and his maxim, people don't buy what you do, they buy why you do it. And that why equals your purpose, your cause, or your belief. This is our why, the reason Scottish Veterans Residences does what it does. We want all veterans to live as independently as they are able in a place they are proud to call home. And that recognises that for some of them, our residences will become their home. So our mission statement expands on that, and you'll note its unifying purpose is for veterans to live independently. So, having considered the why, let's now consider the what and the how. So as you can see, Veterans Homeless has been round in Scotland for a long time. And we were formed in 1910 by two Seaforth Highlander officers who wanted to do something following the sight of destitute sailors and soldiers in Edinburgh's Grassmarket. Scottish Veterans Residences have evolved since 1910 to become a charitable housing association and a registered social landlord. We provide a small number of Scottish secured tenancies, but our principal service is supported housing. Because we are a charity, we are regulated by the Office for the Scottish Charity Regulator. Because we're a registered social landlord, we are regulated by the Scottish Housing Regulator. And because we provide supported housing, we are regulated by the Care Inspectorate. And that's the Scottish equivalent of England's Care Quality Commission. We have no monopoly on good ideas or practice, and so we have a significant number of memberships that allow us to benchmark our practice and obtain support from relevant contemporaries. You'll see in the bottom line there a reference to SHAPE. We don't actually have a seat on the Supreme Headquarters Alad-Parza Europe. Rather, that's the Strategic Homelessness Action Programme for Edinburgh. So our resources. Sorry, Kevin just said there's a slide down there. Look at the slide down there. So these are our principal residences. Top one there is Whiteford House. It's a lovely 18th century building, 85 ensuite it rooms, and it provides a fully catered service. It It's 18th century, and so that brings some challenges with it in terms of maintenance, and will continue to provide us with challenges as we go forward and address net carbon zero challenges and sustainability issues. The middle one, Rosendale, was gifted to us in 1933. It's a Victorian mansion in leafy Broughty Ferry, and provides 44 ensuite rooms, and again, it provides a fully catered service. And then finally, Belrock Close, which is located in Glasgow's East End in Cran Hill, purpose-built, designed and opened in 2014, and provides 30 one-bedroomed flats, each with its own kitchen. So we have a number of Scottish secure tenancies. We provide 46 indeed, located in Whiteford House, the site of our major house of multiple occupancy, and Gilmerton on the southwest of Edinburgh. Again, a couple of places in Broughty Ferry. The slide in the middle there, which you can see, is the gate lodge for the main house itself. That's a 4-bedroomed house. And we were delighted, because our objects allowed us to do so, to be able to offer that house to an Afghan family, to an interpreter and his 5 children and his wife, and now they're living happily in that house in Broughty Ferry. We were able to do that because although we provide support principally for veterans, military veterans and the Merchant Navy, we don't do so exclusively. And so we were able to make that judgment, and the governing body were delighted to be able to offer that. And again, we have another 21 flats co-located with our supported service in Cran Hill. So housing support, how do we deliver what we deliver? So service users retain their homeless status. And that's because we want them to have the ability to get homelessness points when it comes to the point scoring for the allocation of properties. We provide specialist housing support in that each resident has an individual support plan. We currently use Better Futures as our framework, but we're in the process of designing our own, and we'll hope to introduce that this year. And each resident is supported by a qualified social worker. We provide on-site employment support with assistance and partnership with Walking with the Wounded. And we provide funding for courses. But this is an area where I think that we need to do more. And at the moment, we have an unofficial what looks good in terms of outcomes. And what looks good in terms of outcomes at the moment for us is that veterans are able to live independently in their own accommodation, in supporting their own tenancy. Normally that will be through universal credit housing benefit. And where I'd like to get to is that veterans are living independently, but they are sustainably employed as well. And that is the measure of success that we should adopt. Because I don't need to tell the members of this audience that employed people tend to be healthier people and have better physical and mental well-being. So this is an area I think that we, over the next few years, will look to develop. We provide in-house and external activities. Luckily, we are able to call on the services of a former Royal Marine physical training instructor who colloquially was a woolly hatter, in that he used to do lots of adventurous training, mountaineering, canoeing, rock climbing, and he has the instructional capability to take our residents to do those activities. We also provide in-house indoor activities, and I'll show you some examples of this on the next slide. I want to point out, though, that our activities that we do are not an end in themselves, but they're a means that act as the nexus between the individual resident and reacquiring the physical and mental well-being to live independently. And as I said, I'll show you some examples of that on the next slide. We provide on-site mental health support. We provide therapeutic counsellors for those residents that request mental health support. I would say that it's in addition to NHS provision, but I'm afraid that on occasion it stands in for NHS provision because of the timelines that it can take for you to access that. We offer CBT, psychodynamic counselling, and if it requires it, hypnotherapy. And we also provide move-on support. So we're able to link residents with social housing providers and with other charitable providers and care providers if necessary. And we're able to fund furniture and white goods to set them up in their own homes. So a quick view of some of the activities that we get up to: pottery clubs, gardening, art clubs, canoeing, throwing yourself in deep water, wearing a wetsuit. Those are the sorts of things that our residents do. And then some statistical analysis. This is the analysis from last year. You can see that 68% of our residents had spent less than 9 years in the military. The largest cohort is the 51 to 60-year-old cohort, with 22%. And I would just ask the question, is this indicative of the delayed transition that Kevin alluded to? And also, it's a recognition that our residents seem to be older than the national statistics. So if you remember the slide, it was clustered towards the left of the slide, whereas ours is clustered towards the right. I'll just pick out a few points here. Our previous situation, 7% rough sleeping, so not that many. But if you look at those housing situations, a lot of homelessness is hidden by alternatives. So temporary accommodation, sofa surfing, and other institutions. And this, for me, is where the statistics, the homeless statistics, could be misleading. Because if you count the people sleeping under a bridge on one night in London on one night of the year, and those are counted as homeless, you're going to miss everybody who's sleeping on a mate's sofa and is sleeping elsewhere. So I hope that the census and further analysis will help us truly to get a more accurate picture of veterans' homelessness across the country. And I think the two things I'll pick up on here is the 549 hours of counselling we provided in 2021. That is significantly down from the over 800 hours of counselling we provided in 2020. And the explanation that I will offer you for that is COVID. And that residents, when they were locked down during COVID, requested additional counselling to help them through the challenge of what was going on. That's the explanation I will offer to you. I've yet to prove it, but that's what we think went on. And our key audience is the Army. Understandably, it's the biggest service, and within our population, it's predominantly Scottish infantry as well. Well, it would be, wouldn't it? Because we're in Scotland. Saying that, we take residents from all over the UK and indeed the Commonwealth. So if you're a provider, if you're a referral agency, and you're looking for somewhere to go, and your client is willing to come to Scotland, we will look after them. So I hope that's been interesting and give you an insight into the small contribution that we as an organisation make to preventing veterans' homelessness.
Thank you very much indeed, Martin, for that overview of the safety net that Scotland is providing for veterans. So we come towards the end of our our presentation, and I think we've identified some key themes here, and most importantly, there are some differences from the wider population. And I would like to stress the point that I think came out very strongly from Martin's presentation, and in fact, cross-cutting across everything that we've heard today, and that is that the middle-aged veterans are at particular risk. There's been a lot of emphasis recently on transition in terms of the young veteran, the early service leaver. We know there are issues there, but actually, we've tended to slightly ignore the older veterans, and yet our research on suicide, for example, shows that middle age is the highest risk time for suicide. Our research on mental health shows that the highest risk time for mental health issues to become severe is in middle age. I think we need to shift that emphasis slightly from being very focused on the young veteran over to looking at our provision for the middle-aged veteran and the delayed transition, the person who left service some time ago, and making sure that the services that we're offering actually appeal to and reach out to those people who possibly might not really be thinking about their status as a veteran in terms of looking for health and looking for help. And the other issue, I think, which has come out in conversation in preparing for this session, has been that there are a number of elderly veterans who are left on their own, having lost their partner, who actually just seek the company of other veterans. And again, there's a need to reach out to them and offer them some sort of support and an environment in which they feel comfortable. So, just to summarise then, We've heard a lot about how we are making a difference. We're reducing the number of homeless veterans. And what has led to that? And it's that proactive approach to homelessness, the provision of dedicated facilities. It's the very strong positive engagement with central government, local government, the 32 local authorities, and the benefits of collaborative partnerships. And as we've heard before, it's that spirit of cooperation, collaboration, and communication. So with that, I'd like to move on to the panel discussion. Now, we are a bit short of time. We've had a vast number of questions, which is wonderful, but I'm afraid we're not going to have time to get through all of them. Otherwise, we're going to eat into the comfort break that follows this session. So we'll now lead off into the first of the questions. And the first question is from Andy Bacon, who's asked, are the more established or older veterans seeking housing longer serving, or are they short service but delayed housing issues? Kevin, perhaps you'd like to answer that.
I think the simple answer is it's a mix of both. So some of those might have only served a few years service a number of years ago. Some of them may have served a full 22-year career, and again only left maybe 5 or 6 years ago. So again, the balance is very, very mixed on that. I think the main point to bring out from this is that it's been recognised that tenancy sustainment from all levels, but particularly those of the more established veterans, is something that we need to look at, and that's why one of the recommendations is that there's a tenancy sustainment service put in the private rented sector to cater for those individuals.
Thank you very much, Kevin. Question from Gavin Oxborough. How many participants in the research, veteran participants? I can answer that from the point of view of the Scottish Veterans Health Research studies. And the first study, which looked at veterans up to 2012, was 58,000 veterans and 173,000 comparable people with no record of service. The study, which is currently ongoing and reaching its conclusion hopefully this year, the Trends in Scottish Veterans Health Study, we're looking at 78,000 veterans and 253,000 matched civilians. Question from Jim McDermott. Is the nature of veterans' homelessness in Scotland different to that in the rest of the UK? Or are there lessons that can be passed on to benefit organisations in England, Wales and Northern Ireland? And if so, is there a mechanism for such communication?
Whether it's different, we don't know. We know that there's other research going on. The No Homeless Veteran Campaign second phase is going on or being in the process of being organised. So we know that's going on. We know that also the COBSO housing cluster is also working on veteran statistics as well. So again, I think once we piece all that together, we used a report that's been provided in Scotland to COBSO, and I know they have got a copy of that report, and I think once we have the collaboration, the communication on that side of things, I think we should then be looking at how we look at this, tackle this as a UK-wide issue rather than individual countries within the UK.
Thank you very much, Kevin. And finally, I'm afraid we've come to our last question because we are almost out of time. A question from Pat Kelly. With the shortage of local authority housing and increase in private landlords, is there any provision for some kind of register for landlords to give priority to veterans for their properties?
I take it this is me again.
I think it's you again, Kevin. Sorry.
Yeah, I think there's every possibility of introducing a register, but I think you can all imagine trying to introduce that for private rented in the private rented sector would be quite difficult. But I think one of the things that we've recommended in the report is that they've got to prioritise, social landlords have got to prioritise veterans along with housing associations. But we're also looking at wider ways where we speak to local authorities on a nomination rights basis to gain further accommodation for veterans, and Veterans Housing Scotland are currently talking to the 32 local authorities just on a basis of them providing an extra 100 homes per year to Veterans Housing Scotland on a nomination rights basis. And again, we're not having any doors closed on that, but again, as you can imagine, it's not going to happen overnight.
Can I just make one comment about that? What I've found is that housing providers, the staff tend to remain pretty static, and you know what you know the services that you provide. But within local authorities, housing departments, there's a steady churn of staff, and corporate memory isn't perhaps what it should be or could be. And so that you need a steady drip, drip, drip of information from housing providers to the local authorities, so that there's a memory jog there somewhere that says, I know that the following providers have accommodation available. And COVID has made that quite difficult because you can't go and visit people in their offices and introduce yourself. It's difficult to do it by Zoom, it's difficult to do it on Teams or by the telephone. So hopefully with COVID measures now being lifted significantly, housing providers can get round the local authorities and say, this is what I can offer, these are the vacancies that I have.
Thank you very much. Can I just say that apologies to anybody whose questions we didn't get round to, and do feel free to identify one of the speakers over the breaks and put your questions to them in person, and all of our speakers will be very happy to answer questions.
And just one other thing to add about that is that the questions that aren't answered here will be placed on the hub with the relevant speaker providing the answer in due course by next week. So we now pause just for a 10-minute quick comfort break, and we'll bring the additional speaker that we mentioned earlier into the very start of the next session before we do Wales. So we've got 10 minutes for a quick comfort break. Back in the room, if you would, by 5 to, please.